to the Sports Pharmacy Network, where we dispense clinical and evidence-based information to optimize health and human performance. I'm Brandon Welch, and I'm a clinical sports pharmacist and founder of the Human Performance brand, pharmacy athlete, and host of the show. Today on the show, we have our co-host, Dr. Jessica Beal-Stahl, who is a clinical sports pharmacist consultant, where she has a strong focus on women's health and athletic performance. She's also the director of clinical services at Hobbs Pharmacy, where she leads a lot of the clinical wellness initiatives in the community. Lastly, she is also vice president and co-host of the Sports Pharmacy Network. So be familiar with these faces because I'm sure you will see her on more episodes. In this episode, we want to discuss a hot topic, so get on your feet, guys, that has been emerging for the past decade, if not more, which is concussions. So some of the things that we will discuss. What is the current diagnostic criteria for concussions? What is a concussion? How is it appropriately defined? What are some of those hallmark signs and symptoms you will see in someone with a concussion? What are some of the long-term implications or complications of a concussion, whether that be second impact syndrome, dementia, pugilistica, hematoma, or even cerebral contusions? What population could be at high risk for concussion? Gender differences, we got to think about age, medical history, domestic violence, and then even military personnel. What are some of the current treatment options available? What are some of the non-pharmacological things outside of just physical therapy? This is a very collaborative approach to get players back to play. And some of the pharmacological options as well that are available to treat when necessary. Lastly, guys, what are some of the future treatment options that are in the pipeline for concussions? A lot to talk about on this episode, but we are excited. What's going on, Jess?
Yeah. Hey, Brandon, I'm excited about this. Concussions are I think since, football is so big in the United States, concussions are just one of those things we've heard about. We see happen on Saturdays and Sundays on football games, but it impacts so many more people. And a lot of people don't realize all the other people at risk, like you said, car accidents, military, domestic violence, all that. So I think this is an amazing topic in sports, but also just for everybody to kind of have some awareness of.
Absolutely. And, when I think about concussions, probably more than a little bit over a decade ago, it was kind of like a more silent epidemic. But as you're starting to see more and more cases starting to kind of reach the surface, I think it's very important for us to continue to bring awareness around this topic.
I do. I think as we started talking more, as more people started talking about mental health, and that has become more aware and a more okay topic to bring up, that I think concussions kind of go along with that, being a injury that you don't see. And being able to talk about that goes along, I feel like, the lines of mental health. So I love that this conversation is happening.
Let's jump right into it.
Yeah.
So there's been a lot of media hype and negative press surrounding this type of head injury called concussions, especially with the youth athletes who are a little bit more vulnerable, who play contact sports like football, lacrosse, or soccer. Or we can't even forget the equestrian sports, such as people who like to ride horses. As a consequence, this type of head injury in contact sports, such as tackle football, has become a very contentious issue with Americans, especially when considering little league players that are trying to play some of these high contact sports. And one thing I really want to note is that we don't want to make this episode fear mongering for any of our parents that may be listening, is because, look, there are really good treatment modalities for some of our athletes that get concussions. But it's very important for us to address it immediately, because the faster we catch a concussion, the faster time it will take to recover. And so we really don't want this issue to tend to linger.
No, and I think it's important to realize that the benefits of activity and movement are so much more than if you end up with one concussion, or even if it's two and they're 10 years apart. So I think understanding that movement and exercise and team sports and all of that is super important too. So I love that. Not fear mongering, but something just to be aware of.
Absolutely. Yeah. So when we think of what is concussion, to kind of talk about the definition simply. Yeah. The Concussion Legacy Foundation states that a concussion is caused by a blow or jolt to the head or by a hit to the body that causes the head and brain to move rapidly back and forth. And so if I can simplify this or put some type of frame of reference, and I'm going to butcher a well-renowned researcher who specializes in concussions over at UPMC. And you'll love this analogy,
I
Jess.
can't wait to hear
And so
it.
if you think about, for my egg lovers, if you think about the brain as the egg yolk inside of a shell. So if you were to shake that very violently, so that yolk, which is your brain, every time it hits that hard cavity, due from acceleration, deceleration, or translational forces, if it's hard enough, this is when we start to see these incidents of concussions. It's when the brain essentially collides with the skull, which can cause neurological dysfunction as a result of axonal damage and membrane stretch.
I was going
And
to say, do you want to kind of explain like what's the importance of an axon? Like for some of us that may, if we're just general lay population, like what do axons do? Why is this important if those get damaged?
so axon is part of what's called like our action potential, right? So when we think of our
Mhm.
action potential, this is our electrician. So essentially what it does is it helps with the communication of our cells. And
Okay.
so when we have any type of damage to these axons, our cells aren't going to really communicate as efficiently as they should. And I don't know if you have anything else to add to that, Jess, but that's kind of how I look at
No, I
axon.
think that I like that. No, I think that's a great explanation. I think I know when I first understood concussions, I was thinking like my brain just gets bruised. Like it's like a concussion, like I get bruised. And I love the analogy. I had heard it in a similar frame of being like jello in a Tupperware. And like you shake the jello, and sometimes when you take the jello out, it's still ripped. And I was like, oh, that makes sense. But understanding that these little axons that caught the damage to them is the reasons for all the symptoms, and will also be some of the reasons for what we're trying to do in treatment. So I think it took me a while to understand it wasn't just a bruise, it was actually stuff being damaged that takes time to heal, and it's not like 2 days and you're back out there.
Right. And when we even think about the cell membrane,
Yeah.
simplify that too. Our cell membrane is essentially meant to protect our brain or skull from any type of damage.
Mm-hmm.
And it has certain layers that are essentially comprised of what's called like our meninges that kind of sits over on top of our skull to try to hopefully keep its durability from any type of, exertional forces that are being exerted on, our brain or our skull.
Yeah.
And so the good thing about, the brain is it does have these protective mechanisms for any type of collision like these concussions. And to dive a little bit deeper into some of the biochemistry of it, when we have a concussion, we have what's called a multiple ionic and physiological changes that take place, such
Yep.
as an efflux of potassium. And a lot of times when we think of potassium, yes, it is an electrolyte. But back to your question about what is an axon, these electrolytes are responsible or part of the process of cell communication. And so when you have a concussion, instead of our potassium or some of our other important minerals that are supposed to be stored inside of our neurons to help with that communication, they tend to leak intracellularly or extracellularly, which can cause some of this neurological damage. And so, as I kind of alluded to a little bit earlier, with potassium being extracellular and it leaking, this is what causes us to have what's called, glucose deprivation. And
Okay.
so
Yep.
our brain tends to starve for energy. It affects that glucose metabolism. And then also simultaneously, we have an influx of calcium. And now with that influx of calcium, that causes vasoconstriction and decreased cerebral blood flow. As a result of that, our brain tends to have hypoxia or starving for oxygen. And so essentially, Jess, what it kind of comes down to is when we think about what's going on in the brain metabolically, it seems like there's this mismatch of supply and demand of energy and oxygen because of all the wear and tear and the imbalances of these essential ions or electrolytes such as potassium and sodium.
Yeah, that's super interesting to explain that on a cellular level, that it's not just a physical bruise that your brain has. There is actual biological changes that are happening and trying. And I find it most interesting is the glucose changes and the electrolytes. Like, I find that so interesting. So as we dive into it further, when we start looking at treatment options or support therapy that you can offer, you'll see some of it being treating these pathways or helping support these pathways so that your brain gets more oxygen or gets less inflammation or gets more glucose. So, and for a lot of people listening, I'm sure they know, but most people, your brain eats so much energy all day long. Like, it's like it needs all this energy to just function. So having a change in that can be a huge impact. So you would expect
as they say, the brain is a metabolically hungry organ, probably one of the most hungriest organs in our body, if we can put it any type of way, right?
So I should have lost weight in pharmacy school then. So in that, so if our brain is starving for energy and starving for oxygen, what kind of like symptoms does that lead to? So would you expect similar to like altitude sickness, or what do you expect to see in a patient that may present with a concussion due to what you just explained?
So essentially it comes down to this too. You have what's called sympathetic nervous system arousal, right?
Perfect.
So when we think of our nervous system, we have fight or flight, or we have rest and digest. So essentially our brain goes into fight or flight mode. And so with us having this sympathetic nervous system arousal and our brain becoming decompensated, we can have some of these signs and symptoms such as blurred vision, dizziness, fatigue, more on the cognitive side, confusion, slurred speech, retrograde or anterograde amnesia, which is loss of memory prior to or after a concussion. Some of the emotional components such as anxiety, depression, personality changes, or even sleep disturbances. And one part we forgot to address is this also causes some damage to our vestibular nervous system, okay, which is responsible for some of these signs and symptoms that we just kind of talked about. And so with these signs and symptoms, this is kind of what really helps us guide some of our therapy options to kind of help with the recovery process of concussions. And then when we kind of dive more deeper into the diagnostic criteria, I think everything's going to make sense when we start to package concussions up, with it being, unfortunately, a microscopic issue that you can't really see on any type of scan that we do.
Yeah. And can't see it on the outside at all. So that makes it really hard. And I feel like, especially dealing with athletes, both of us being athletes, sometimes you don't want to admit that you may be having symptoms if that means missing a game or a tournament. So sometimes it is watching athletes and how they perceive, like, are you noticing small signs and changes in them? So sometimes you may not have the reporting of the athlete of these symptoms either, just because it prevents them from playing simply.
So true. And, as we kind of talked about a little bit earlier in the episode, when we start to spot any of these signs and symptoms, and to kind of be clear, symptoms is kind of what the healthcare practitioner or someone else observes, and signs is kind of what the athlete reports to us.
Yeah.
And so when we start to see some of these signs and symptoms immediately after some type of collision that we may think is a concussion, it's important to, pack the player up, get into the medical office, and figure out what exactly is going on.
So that's the reason for like the concussion protocol that you see on, they went off the field for a concussion in the NFL. But what do you do, or what are your thoughts on like high school players that may not have the medical staff, or somebody that experiences it on the little league field, or just like somewhere that it's not there? Like, what are your thoughts on that?
So sometimes that can be a challenge. Usually it's the parents being the major liaisons, and hopefully if there's any type of athletic trainers or even the coaches, I would assume at the very least should have some type of awareness or wherewithal when it comes to some of the signs and symptoms of concussions.
Okay.
And so, yeah, with you having that limitation, unfortunately, with you not having like a high trained professional like the medical staff, like a medical doctor, DO, athletic trainer. It's very, very important for parents, coaches to be champions for spotting some of these signs and symptoms after any type of collision that a player may have on the field.
Yeah, I think it's important to note that some of these don't show up immediately. Like, you may not have the symptom today and you had a concussion. It may be 5 days later. It may be a week or two later. That this is not just it happened today, the symptoms are tomorrow, and then they improve. This is kind of a waving, kind of hard to pin down kind of injury, we call it. So I think that's important for people to note that this can be laxing and waving and not here today and gone tomorrow, but then show up again. So being aware of that with symptoms.
We always say, it's better to play it safe and get that athlete checked out.
Yeah.
I can't stress it enough, with this being a functional injury, you really rely on the signs and the symptoms and the time that it happened. It's a very comprehensive approach and examination that has to go on in order to diagnose this. You can't see this on a CT. You can't see it on an EEG. Yeah. Labs, there unfortunately is no biomarkers or labs to detect it. Labs can be helpful to a certain degree in assessing injuries such as an arterial blood gas.
Okay.
Look for the presence of, hypoxia, which is a lack of oxygen, or ischemia, to kind of indicate any type of impaired ventilation. But outside of that, and then also maybe a CMP to look at any of the electrolytes to see if there's any imbalance there. But for the most part, with this being a functional injury and it being very microscopic, again, really have to rely on the signs and symptoms to
I was going to say
diagnosis.
I have seen them out there. There are some great tools out there. I know I think it's the concussion recognition tool, which is kind of for the general population. There's a couple apps and a couple concussion hospitals or groups that put these out that kind of allow parents or athletes to go through that. There's also the concussion. There's ones that are more in tune for healthcare providers that are more in depth, like the sports concussion office assessment tool. So a lot of these came out with the new consensus statement that came out in October. But I do like the fact that there are now ways for athletes or parents or coaches or ATs or PTs that are on these teams to actually track symptoms and how their athletes are doing versus just going on word of mouth. There's actually apps that kind of help track some of them.
Yeah, I know at least in our practice, we use the SCOTE 6.
Oh, SCOTE 6. Yeah, that's the sports. That one. That is definitely, that was a pretty new one came out. And I think it's very helpful for providers to be able to track and use those assessment tools.
And I know out there, I think UPMC, they use the VOMS. So every institution may use something different. I know VOMS, I think it stands for vestibular, ocular, motor skills, which may be a little bit more objective versus subjective. And then I know that some institutions are a little bit more advanced where they'll use like an impact test.
Yep.
But there are plenty of different protocols or different assessment questionnaires out there to help kind of diagnose for concussions.
Yeah, I think it's great to have one, even if you just choose one and be able to track it. And if you have an athlete have a concussion, be able to take an assessment then, before, after, during, and you can see how it changes. I think, making sure you stick with the same one so you're comparing apples to apples is super important, and not just do all of them. Just pick one if you're going to use one.
Be consistent, essentially.
Yes, be consistent.
So let's kind of dive into some of these long-term complications that can happen from a concussion.
Yeah, so we've talked short-term, but, we've seen a lot of, I would say probably the biggest thing we see is like ex-NFL players that have had repeated concussions over there, or like boxers that have had multiple concussions, and you're seeing long-term health impacts, even some, and this may be a trigger for some people, and I apologize, but some people committing suicide because of mental changes that they believe is due to concussions. So I think it is definitely an important thing we talk about. So what are some of the long-term concerns we have for repeated concussions?
So one that's rare that can happen is called second impact syndrome. It
Okay.
can be due to some type of misdiagnosis or early return to play. And
Ooh.
so repeat concussions before any type of resolution of symptoms resolve or recovery from an initial concussion, this is when you can fall into this category. And by falling into this category of second impact syndrome, the more concussions you get, unfortunately, the higher at risk it puts you for getting subsequent ones going forward. And so it's also, while it's very important to obviously catch it early, it's also very important to make sure that we stay on top of when is the appropriate time to return to play, which is why they have certain protocols in place that have gradual steps and a progressive plan before somebody returns back to play.
I think that's
Also,
important. You do have to
dementia.
heal, and
Yep.
you may not see the healing. So being able to follow some protocols and some steps, and that it's not 2 or 3 days, that it can take weeks. And that is difficult. I know for an athlete, I've been an athlete. And so it is very difficult to withhold and let your body heal. But I think that is really important here to let people know you do need to heal in order to not put yourself more at risk for another concussion or some of these more severe conditions.
So another long-term complication, dementia pugilistica.
Okay.
Long name,
Explain
right?
that one.
So it's commonly seen in boxers. They call it the punch drunk syndrome,
Okay.
which is kind of indicated for having irreversible brain damage and having symptoms very similar to dementia or Parkinson. And so essentially, there's a lot of clinical depression that kind of ties into this complication. Again, it's not something that is very pronounced, but it is one of the long-term complications that can happen. CTE, I mean, we know that that's very common with, you talked about retired athletes,
Yeah.
right? And so when we talk about concussions versus CTE, with concussions being microscopic, when we think about something that's macroscopic that we can actually see on any type of scan, like a CT scan, this is where we look into, hey, does this former athlete have CTE, any type of brain atrophy or brain damage? What do the tau proteins look like? And I don't know if you kind of want to elaborate and speak to CTEs a little bit more, Jess, but this is something that's kind of been in the news for quite some time.
I was going to say, I've seen it. I haven't seen it on the clinical side just because I don't have the hospital imaging and all of that. I mean, I've read on it, and I feel like it's one of those super sad conditions to hear, because it is years down the road, and it may be that you didn't know better in your 20s or your 30s,
Yep.
and now you're paying for it down the road. But just to see I remember reading an article and seeing the images of like a healthy brain versus a CTE brain, and it's like, oh, wow.
It's alarming.
There's a lot missing.
Yeah, there is.
Yeah. And it's so like, it depends on where the concussions happened, how much of the atrophy. So everybody presents slightly different, but I think for most people dealing with being the loved one of somebody with a CTE is probably hard too, because of the mood changes and the dementia and just the full body encompassing symptoms that it does have, and impacts on quality of life and your whole life.
Yep, it definitely does affect quality of life. You can see that. And I know you talked about some of the mental alterations that athletes can have from concussions. We talked about depression. I mean, someone who gets a CTE, I mean, this is a hallmark indicator that someone will have some of those signs and symptoms, right?
Yeah.
Lastly, you may see focal mass lesions, cerebral contusions, and hematomas. So these are macroscopic things you can also see on scans, whether that be an MRI, CT, or an EEG. So these are something, we really want to, be cognizant of. But again, it ultimately comes down to making sure we treat this thing early and managing it appropriately. Now, Jess, let's move into like who our high risk group would essentially be. I know that you have really good expertise on the women's side, and so love for you to kind of speak to that.
Yeah. So I feel like we've kind of covered them, but to kind of summarize them in a nice little like pod for everybody. So obviously sports, like high impact sports, we're thinking soccer, football, ice hockey, equestrian, anything where you may have a fall or an impact. For some people, one of the biggest sports for women is cheerleading, which a lot of people wouldn't think about, but it has to do with the falling. Gymnastics is the same thing, falling and hitting your head on either the equipment or the ground or a shoulder. So any type of contact sport like that. Car accidents, the number one that we see or that they report is falls. So this may be young children, older adults, but anybody falling and hitting their head. And then car accidents, and sadly, one of the biggest ones that they don't have a good handle on the percentage is domestic violence. So a lot of women or men in a domestic violence incident may report to the hospital if they even go to the hospital, but often do have symptoms of concussions. So I think those are the biggest. Oh, military. I forgot you guys.
Military
Sorry, I
personnel.
apologize. But military is also one at high risk for concussions.
And when we think of age too, right?
Yeah.
Our adolescent athletes, I'd say would even be at a higher risk because they're a more vulnerable population and their brain essentially is kind of still developing. And
Yeah.
so it does show like with adolescents, at the adolescent ages, any of the people in this group, when they get a concussion, the recovery time could typically take a little bit longer.
Yeah. I think with adolescents, one of the things you also see is the lack of musculature. And so
Yep.
they're more likely to have a head move in a more violent way because you don't have all the muscle that you might have after puberty, even males or females. So I think some of it may, and just their gumbiness being
They're
a
still
young
developing
kid.
that neck strength.
Yes, yes. So
And sometimes, people who have a history of like migraines, anxiety, depression, when you get a concussion, sometimes those symptoms can be exacerbated.
yeah, yeah. One that we've kind of alluded to, something that I deal with is females. Females are at a higher risk than their male counterparts by almost 3 times, which is, so if you did female soccer players to male soccer players, you're going to see more concussions in female soccer players than you are males. Same thing with like ice hockey, or two of the sports that you see male and female, both athletes. Same thing with like rugby. So I find that so amazingly interesting. And there are multiple reasons for it. So as we alluded to, same thing with the little adolescents. Females tend to have that less shoulder mass, neck strength, musculature that you would see compared to males. And then you also have some data showing that the females may have thinner axons. So therefore they are more likely to break. So you're looking at like maybe like a pencil instead of the pencil lead. If you wanted like a comparison, this is not accurate in any description, but just it's easier to break a pencil lead than it is a whole pencil.
Yep.
So females' axons tend to be much thinner.
Good frame of reference there.
I try. My dad's the one who always makes me make sure I can do a good analogy. It may not be right, I try. In some things, women, they do also believe that their heads may be smaller. So especially in soccer, the ratio of a female head to the ball versus a male's head to the ball may cause them to experience more violent concussions. And the two last things are women, they believe women may report them actually more. The symptoms, that they're more likely to step up and say that they're experiencing symptoms than some of the male counterparts. Sorry, guys, but
Well,
they
say women are more honest than men anyway.
So true. So true. Some of the guys are going to be big and tough and just say everything's fine. But I think the one that I think is so interesting is that the female menstrual cycle can play a huge impact in how a woman experiences a concussion. Like I know there's a lot of talk on female menstrual cycle and training according to it and eating according to it. And some of that data is very, very mixed, but there has definitely been extremely consistent on concussions. So they have found that progesterone, which is a female hormone, is very anti-inflammatory and very neuroprotective. So if you have a concussion in the second half of your menstrual cycle, so that would be after ovulation, right before your period starts, you're at a high level of progesterone. But what interestingly happens is that progesterone suddenly drops off and you experience menstruation. Due to that sudden drop of progesterone, you suddenly have worse symptoms. So versus somebody who maybe got their concussion, say, in the first half of their period, they would have almost 3 to 4 weeks of increasing progesterone, which is protecting their brain for a longer period of time. So they have found that if you get it in the second half of your menstrual cycle, women are more likely to have more severe concussions, longer symptoms, more severe symptoms. And if you get it in the first half, they tend to be less severe. Same thing goes true with a woman on birth control pills, because birth control mimics natural progesterone. It's not, but it mimics it. They found that if you're on birth control pills, that is similar to having it in the first half of your menstrual cycle, and that you have extra protection with progesterone. So I find that super intriguing, especially because I do a lot of women's health work.
That's very interesting, and I'm glad you brought that up, Jess, is because I mean, I can only imagine. Obviously, I'm a male, but the hormone swings that women has through menstruation, I'm sure, are heavy.
It can't, and it varies for every woman out there. Like some go flying through amazing, and you have others that are completely, like, a day or two of the month, they're like, I can't do anything. I'm in bed in pain, which is not normal. And so I think it's really interesting to see how women respond, both physically and mentally, to their fluctuations in hormones, because they can be different. And it's crazy with a woman because it can be different for different stages in life. So in your 20s, you may be good, hit 35, and you may be like, I'm a train wreck because my hormones are everywhere. And so it's really, I find it so interesting. And that's what I think one thing that makes studying females athletes even more challenging is because throwing in their menstrual cycle and hormone changes and age, and honestly, as we've talked about before, undereating or undertraining, undereating and overtraining can cause your hormones to decrease. So that can play a role in your hormone levels. So I think I can see why it's hard to do all this research on women, because every day is different.
No, I can imagine. And
you live with a woman too, so I know you understand. And I God love my husband some days. He's like,
I feel like the male physiological system is so simple.
Correct.
When you think of like the female reproductive system, I mean, you got, the first half of your menstrual cycle where you have like estrogen or the luteal phase, and the second half you have progesterone, follicle stimulating phase. And it's kind of like it's always going on seesaw. And one of the things that I just became knowledgeable of from an endocrinologist who are experts in hormones is he was actually telling me like the best time to check a female's hormones, to check for accuracy and precision, is typically 5 to 7 day, like the 5 to 7 day window when they're in their menstrual cycle. Is because I know in my practice, like we would run these female hormone labs, when they're out of menstruation. And sometimes you'll see them very elevated. Mm-hmm. And then it gave me cause to pause because they wouldn't have any symptoms. Mm-hmm. Then when I spoke to an endocrinologist, he's like, you're doing it wrong.
Yeah.
Do it within that window because that's when you're going to get the most accurate synchronization of those hormones. And it drives home your point when it comes to, the menstrual cycle, unfortunately being an influencer when it comes to being at that elevated risk of concussions.
Yeah. I love that, the testing, because I know I like to see them drawn there. And then the only other time that I really like seeing hormone levels is usually like if you're on a 28-day cycle, like 19 to 21. So you can see like the high point and the low point, and you can kind of start to picture what's happening. Is progesterone going high enough? So I think it is super helpful making sure, if you're a female out there, getting your labs done at the right time can give much more information than just pulling them randomly willy-nilly, is super helpful. So side note, if you get hormone testing,
don't go to Brandon, who's giving inaccurate information. Go to a specialist like Jess or an endocrinologist.
But I think the female body is amazing, learning. But it can throw ruckus to data, to studies, but it's something you do have to be aware of, being a female athlete, that it can impact different things. But I think the one thing I tell every female athlete, there's never a bad day to win a gold medal, to set a PR, that it doesn't matter what day of the menstrual cycle you're on. If you're on birth control, if you're not on birth control, you still can achieve anything. So it's just something to be aware of. If you do experience a concussion, that it may be worse depending on what time of the month you have it.
Yeah. So let's move over into treatment prevention and
treatment. This is where we shine. We're pharmacists.
And so I felt like earlier we kind of dived in to some of the preventative measures just slightly, but I know that there's helmets, there's mouth guards, and there's other devices out there that can help serve as protective mechanisms to prevent a concussion. And then obviously, when you get that first concussion, making sure you're going through those protocols with supervised exercising and training protocols, rather than going out and doing them on your own. Do you have any other suggestions, Jess, when it comes to, prevention or supportive tools for some of these athletes?
So I think you touched on a lot of them. So I know helmets, the main thing of a helmet is to prevent your brain from being fractured more or less than it preventing a total concussion. I know that a lot of the new helmets have a lot new technology, and you've seen, I watched it on, I don't know, one of the football shows, where they now have like the extra fluffy heads helmets so that they're not, or you have periods where you don't have contact to help limit the amount of concussions. So helmets are out there, but there was an interesting read on if you had, I think it was soccer or lacrosse. I don't recall the study I was reading. And it was saying that they put them on, they were male athletes, and they put soft helmets on to help prevent concussions. But they found that the helmet may actually make them play more aggressively, thinking that it was total protection, which I thought was an interesting thing. So helmets are there, but you still have to do a lot of other stuff to help prevent them. They are not 100% proof, I think.
So there was also that technology too. I know that at some point they had these accelerometers implanted inside of the helmets to kind of quantify and measure, any type of acceleration, deceleration, translational forces, and they were able to quantify those G forces.
Yeah.
Anything that's over G60, to kind of put a frame of reference behind it, you would be at like increased risk of getting a concussion. And so I think the technology that's starting to kind of come out, that's emerging, is very protective.
There's something, and I want to call it's something with the Q, and I can't remember the name. It's something you wear around your neck. That I think it also does the same in measuring changes in acceleration and deceleration and translational forces. I don't know, not sponsored by them, nothing, but I know I had in my research on concussions have seen a neck thing that you wear. I think it's for anybody, it's not preventing, it's giving you data to assess if this patient or athlete is at a higher risk of having a concussion. So it is a tool. It is not a prevention is probably the best way to put it. There was some interesting research at one point showing, do custom mouth guards, by the way that they hold your jaw, does that put it in a better place to have less risk of concussions? From all my reading, that data is still very mixed. Doesn't mean that you shouldn't protect your teeth or your mouth. They can be very expensive to have dental work, but mouth guards are something that there is some research being done that it may help with concussions. I feel like outside of equipment, the most interesting thing I have seen recently was the new consensus statement that came out in October of last year, in the International Conference on Concussions in Sports.
Mm-hmm.
And it was published in the British Journal of Sports Medicine. And they came out with some new recommendations, which I think the biggest one for most people was the change in only rest. Most people have always been told immediately after a concussion, you should just do nothing. Like that includes no TV, no computers. You should not tax your brain. You should not exercise. But the interesting information came out that said that there is stronger evidence for recovery benefits of very light, and this is light, aerobic exercise within the first 48 hours, which may be just a gentle walk, very light run, absolutely as light as possible. But a lot of the data was pointing to helping increase the amount of BDNF, so brain-derived neurotrophic factor. Yep. And exercise helps increase that. And so they're finding that may be some of the protection and some of the help. They didn't go into as much the resting of the more like computers and TV screens. That was still there, but it was more making sure that you are moving your body some. And there's like we said, there's so much benefit in movement.
Yeah, no. And to kind of add to that, I think it's very important. So as we kind of talked about some of the physiology earlier, right? When someone has a concussion, the body's in sympathetic nervous system arousal. And so essentially, when you're trying to go through recovery, you want to try to get the body in reverse, which is more of that parasympathetic system, more relaxed type exercises essentially are utilizing some of those tools. And so essentially it comes down to like you kind of retraining some of those behaviors prior to you getting that concussion. So that way you can go back to your normal daily life and tasks that you were doing. And so I think like a part of that concussion protocol is like more of a graduation, progressive step therapy before someone returns to play. And to your point, yes, light aerobic exercise. And after light aerobic exercise, it may be non-contact. And after non-contact, eventually I think you will get to a point to where you're going to be challenged to, go into a classroom and be exposed to light because, one of the symptoms of concussions is photophobia. You start to become very sensitive to light. You're going to be challenged to have to read a book. You're retraining that vestibular system to help activate some of those sensory pathways back up to, again, get back to your normal daily life. And it's like with any physical therapy, right? When someone gets a knee injury or someone tears an Achilles, physical therapy is painful, and it's supposed to be.
It's supposed to be, yeah.
Yeah, it's supposed to be. You're retraining those bone, ligaments, and tendons, and so it's no different from some of the training strategies or interventions, more on the cognitive and ocular level. And so, light aerobic exercise, I think, is a very reasonable option. It's like a baby, right? You gotta crawl before you walk. So same thing here. You're going
Yep.
to walk, and then after you walk, you're going to run, and after you run, you're going to go 50 miles per hour.
Yeah, like we don't need to go from rest back to full contact. I think people miss that. And
Exactly.
I think the one thing that in reading the new recommendations was it's very stepwise progressions, and a lot of it had to do with monitoring, like as your heart rate and your level, you increase the intensity. If symptoms started to show up, then you back it back down and you take a step backwards for a little bit, and then a couple days later you retry it. It's not saying that you have to wait a month and then all of a sudden go right back to sport. It was I loved it because it's very stepwise, and it's like, okay, test it, pass, move forward. Have symptoms, okay, take a step back, and we're going to go back to where we were, stay here for a little bit. You may need a little more time, and that time may be additional rehab. It may be, like you said, it may be like mindfulness training. It may be breathing exercise. It may be simple, but a lot of us, I think, as athletes overlook some of these simple things as being like, that's beneath me, or that isn't important. And being able to do those simple things really, really well and get your body back into that resting state can be really impactful as an athlete, even if you don't have a concussion.
Couldn't agree anymore.
So yeah. So I think onto potential treatments, I guess, or supplements, or I don't know the best way to phrase, because they're not.
We have a toolbox.
I love it.
Supplements, and then we have pharmacotherapy, right?
Yeah.
And so just based off of, like, look, some of this to a little degree can be bro science, but I would bank on more of it also being a little bit beneficial. And so we think of, like, for example, our omega-3 fatty acids, which is an essential fatty acid for the brain, or just in general to support cell membrane integrity. And so back to when we were discussing, the cell membrane kind of being that protective layer from any type of collision, omega-3 fatty acids, which are comprised of these two fatty acids of EPA and DHA, making sure we try to focus more on that DHA side, which helps support central nervous system functioning. And so with this being fat soluble and it being able to cross the blood-brain barrier, there has been a little bit of evidence that shows that it can help support central nervous system function and some of the cognitive impairments that people get from concussions. And EPA, on the EPA side, EPA is more for to calm down inflammation. And so, as you alluded to a little bit earlier, Jess, when you talked about the neuroinflammation that people can get from concussions, this is where the EPA would kind of fall into. And so roughly anywhere between 2 to 3 grams total of a mixture of EPA and DHA. You can get this from, your food sources. So if you think of like nuts, seeds, salmons,
I was like fish,
so your oily fish, or, you have your capsules, your fish oil capsules. If I can be a little bit precise and pedantic when it comes to the capsules, making sure that fish oil is derived from those healthy fish. So salmon, anchovies, herring, sardines, no tuna. We don't want mercury buildup.
Correct.
Okay. Because that can add to the issue.
Yeah, I was going to say, so somebody that's never seen a bottle before, you find this information on the back of the label, like, where would you look if you wanted to know that you were making sure you were getting high quality omegas, especially DHA and EPA? How do you know what are you looking for? Like you said, where do you find this on the label?
Yeah, so definitely look at the back of the label. The front of the label, I always say the devil's in the details, but the back of the label is going to tell you everything you need to know.
Okay.
Down from what are the excipients and some of the binders and fillers that manufacturing company can use. And so, yeah, when you look at the back of the label, make sure, can't stress this enough. And you know this too, Jess, the serving size. And so it may say 2 grams, but it may say 2 grams serving size 4.
Yes. Yes.
You got to consume 4 or 5 capsules in order to get that 2 grams.
Yeah. just why we're on omegas, because I know you and I both love them. And something a lot of people complain about the fishy taste. Do you have any tips for helping decrease the amount of fishy taste, or is there like a brand that you like or anything like that? Because I know
So
that's
believe,
usually the number one factor people stop taking them.
great question. I actually take the Thorn brand. Shout out to
Okay.
Thorn. So Thorn has a liquid omega 3, and
Okay.
it's actually flavored with orange, and so it
Perfect.
totally masks the taste of the complaints that people have, which is that fish
Fishy taste.
odor or that fish
Yeah.
taste.
Or they're burping
Also,
fish.
yeah. That,
Yeah. I was
also,
saying,
and this could be a little bit off the wall, but you can even get a bottle of olive oil and pour it on a teaspoon and use that as your source of getting some good, healthy omega 3s.
interesting. Yeah,
Yeah.
that's awesome. I was gonna say the one tip I have never had to do it, but I've had people tell me is if you freeze them,
Freeze it. I heard that
if you
too.
freeze them, but I will tell you the number one thing is nobody will remember to take them because they're in the freezer.
Yeah.
So I know
So true.
freezing can help, but you do have to remember to take them for them to be appropriate or to work actually. So something else that you may try. But so if you're an athlete and you're playing a sport or you're just somebody, this is something you would take all the time. There's so many other benefits besides helping with a concussion with fish oil. This would be something that most people, you may agree, disagree with me, maybe in one of the top 5 supplements I recommend and everybody should be on is fish oil, just
Yes,
because of our natural diet for most people.
and it's essential.
And it's essential.
So with it being an essential nutrient, our body doesn't naturally synthesize it. We
Correct.
have to get it from food. And realistically, the amounts of omega 3 that are in food are not sufficient enough to what we need on a daily basis. And so, yes, it would be one of my top 5 supplements that I would take on a daily basis without hesitation.
Awesome. Shall we move on to the next one that we both, I know it's another household favorite for both of us. The use of creatine. I know most athletes think about creatine and only being for building muscle, helping gain muscle mass, but I know there is tons of data out there on creatine and the use with concussions, the use for stroke patients, any traumatic brain injury patients, and helping that. So, do you want to explain why creatine is so helpful in the pathway of concussions?
Yeah. So when we think of that energy crisis that we
Yep.
get from, a concussion, where essentially our sodium and potassium pump is having to work overtime to help generate ATP, which is an energy molecule to be delivered to the brain. And so essentially, again, our brain's going through this energy crisis. It's starving for energy. And so creatine enables cells to regenerate ATP very quickly and efficiently, and mainly creatine monohydrate, which has been the most studied. And so, with it being able to generate ATP, to kind of simplify science, to deliver it to the brain, and then also almost serve as an oxygen reservoir too, to deliver oxygen rich nutrients to the brain as well. I think that there can be some promise to creatine. And then also, Justin, I don't know if you saw this article, is that there was an article published by the American Journal of Psychiatry, I believe, and it showed how creatine was used to help augment SSRIs, which we'll get to a
Yep.
little bit later, which is a pharmacotherapy class of medications to help with depression. It was shown to help augment some of those SSRIs to help with some of those depression symptoms, usually in about 1 to 2 weeks. Typically, we know with SSRIs, it takes about 4 to 6 weeks before you start to see any benefit. So by using creatine in addition with an SSRI medication, it can help with some of those depressive symptoms a lot sooner.
Yeah. I find that amazing, especially someone suffering from depression, being able to say you may get some relief quicker, or resolution to some symptoms or improvement. That can be game changing. Instead of saying it's going to be 4 to 6 weeks, 1 to 2 weeks, you may start noticing some improvement, I think can make a patient really feel much more confident in that this is going to work and this may help. I feel on creatine, two things, and they're not related except for by creatine, is one, dosing. I think we need to talk about.
Yes.
So most people is usually a 5-gram dose is what a maintenance dose is. But from what I have read, and I don't know if you've read differently, they recommend after a concussion that you may need to bump that up to 10 to 20 grams for
So
an
essentially
extended
loading
period.
dose.
Yes, yes. Close to a loading dose to help with concussion symptoms. But then on the same thing, we're talking about brain health and lacking in inflammation and needing energy. Creatine obviously just came out. They came out with showing it's helpful in COVID long haulers, which may have some similar etiology in the fact of inflammation and needing more energy. I'm sure you saw that study.
Yeah, I did. And so, yeah, I mean, look, like creatine, I feel like is the unsung hero for a lot of different physiological benefits that go on in the body outside of what we commonly know it for, which is muscle strength, power, and to build muscle. I will also say too, based off the literature I read, when it comes to creatine for concussions, I think that the window of opportunity is sooner rather than later. And so,
Agreed. Yes.
right after you get a concussion, trying to utilize creatine within maybe that 2 to 3 day window range, I think is where you're going to get the best bang for your buck.
Agreed. From what I've read, I agree with that statement. The sooner the better, to help with that. Along the lines of, I know there's a lot more supplements out there that people say that I think for most of us, the data is mixed on a lot of the other supplements. The one that I find maybe creeping in a little bit is magnesium. I see like magnesium threonate is probably the next one that might be creeping in with a little more data supporting its use with concussions. But stuff like curcumin or turmeric and stuff like that, I haven't seen the data to support the use.
Yeah, me neither. The only thing I can think of when it comes to magnesium is, with magnesium being responsible for more than 300 biochemical reactions in the body, I think that its role would mainly play in the metabolism of energy.
Yeah.
To the brain.
Again, I think that I agree with that. It's just one of those that it's like, we've seen magnesium helpful in headaches and some of the other symptoms that you may experience with concussions.
Yep.
And usually most people can't go wrong with taking magnesium. So, but I just haven't seen the concrete data that you see with creatine and you see with omegas right now.
No, neither have I. I think it would be more investigational.
Yeah, I agree.
More than anything.
Yeah, definitely not harmful, but definitely not investigational. So I think we should probably move to, is there any pharmacological treatments? I know I'm going to say this, there's no drugs out there with an indication for concussions. So there's nothing out there with an approved use to prevent or help with concussions, but there are some that can help with symptoms. So we've alluded to one already. So SSRIs, I think is something that that is probably the number one you might see. So let's kind of dive into that one.
Yeah. And so when it comes to pharmacotherapy, it's always important to note that it's usually indicated when symptoms have exceeded the expected duration.
Okay.
It's interfering with the ability for the athlete to function.
Okay.
So when we think of like some of those signs and symptoms again that people can have from concussions, such as mood disturbances, sleep disturbances, headaches, migraines, and so this is when pharmacotherapy can be used to help mask some of those symptoms.
So it's not like, so we're not starting this in 1 to 3 weeks.
No.
This is going to be, the 1 to 3 weeks is rest and time and some of the other things we've talked about, physical therapy, vestibular, getting your body calm. So we're talking a little longer term, that you're having symptoms that exceed probably a month.
Yes, okay. I'd say definitely something that exceeds 3 to 4 weeks.
Okay.
And when we think about building that ecosystem of practitioners to help with the recovery, of someone who gets a concussion. So we have a psychiatrist, we have a sports medicine doctor, maybe an athletic trainer. This is where I think the clinical sports pharmacist plays an essential role,
Yeah.
is because when we think of these mood disturbances these athletes get, and you know this, just like not all SSRIs are created equally. So
Correct.
it's very important to have the knowledge and education on the kinetic profile. And I'll
Yes.
give you an example. And so when we think of an SSRI like fluoxetine, also known as Prozac, while it can essentially help tone down some of those mood disturbances, it also has an elevated risk of agitation. And we don't want to keep feeding the beast, right? And
No.
so, again, we have to look at the kinetic profile. And so, based off my research, I know like sertraline has shown to slightly kind of improve vestibular dysfunction, which is, one of the impairments that people get when it comes to concussions. And so sertraline is a pretty safe option. Sertraline 2 I think, is a really good SSRI for adolescents.
Yep.
I was also reading on one of the newer agents I saw. I think it was Vibrid.
Vibrid. Yep.
Yeah. Vibrid has some good psychomotor skills development that can help out with. And then Trintellix
Okay. I haven't read that one.
But it kind of all comes down to really looking at that kinetic profile, is because some SSRIs can, again, interfere with the recovery process. But to play it safe, some of the common ones I've seen is sertraline, escitalopram. Some of the SSRIs can cause weight gain. You talked about this on one of your previous shows, just about SSRIs causing an electrolyte imbalance. So making sure it's not one of the SSRIs that are depleting maybe sodium, potassium, or magnesium. So again, it's very selective. And also,
the other thing on SSRIs that I feel like some people forget, it can affect sleep, which as athletes, we all know that you need sleep for recovery and quality sleep to help heal. So, looking at that too can also, sleep, I feel like, is one thing we can't overlook on SSRIs.
So like fluoxetine, that's another good example. It can cause insomnia.
Yep.
So so yeah, it's very important. I can't stress enough to make sure that you consider consulting with a clinical sports pharmacist, or who knows, maybe we can be in collaboration with a psychiatrist to figure out what is the best mainstay therapy to kind of calm down some of those mood disturbances.
Yeah.
So we have, sometimes the athletes have sleep disturbances.
Yeah.
Like excess sleepiness, difficulty falling asleep. This is where I think more of the non-pharmacological education would come in, with some of those sleep hygiene tips, maybe considering like a melatonin as needed, but blackout shades, try not to consume alcohol, making sure 30 minutes before bed, you do something that's very relaxing, whether that be yoga, meditation, reading a book, staying away from any type of fried food 2 or 3 hours prior to going to sleep, making sure you invest in a very high quality mattress, pretty good ambient temperature, I'd say anywhere between 65, 70 degrees. You really want to create a sleep sanctuary or an environment that's very relaxing to help calm you down to go back to sleep.
Yeah. I'd say we can't overlook caffeine and the impacts that caffeine may have. And some people may realize it does take a while to get out of your system. So caffeine, working out late, can also impact your sleep. So things to be aware of. One that I know I enjoy is morning sunshine, that making sure when I first wake up is getting outside and getting sun. Mine is with the dog every morning, but I enjoy it because I feel like it helps me sleep better and gets me going for the day. So I feel like the sleep issues can be, like you said, resolved often or improved with doing just some of the non-pharmacological. A lot of the pharmacological therapy out there, some of it obviously we know can't be used without an exemption if you're a drug tested athlete, and others are just something that you need to be used short time. They have a high risk of addiction. And so we do have to be conscious of, if you go onto pharmacological, that it is just for a period of time. And then there is a test to wean off of it, and not something that you're supposed to be on for a long period of time.
Absolutely. And it's even more important too to make sure, we consult or counsel on some of those medication classes to avoid. So we're on this topic of sleep. So making sure, we avoid those benzodiazepines and non-benzodiazepine hypnotics that could be commonly prescribed for sleep. I think in this particular category, if you have concussions, this can really, again, add to the problem and increase cognitive impairment. And so it's better to play it safe, again, by doing sleep hygiene or some of the safer alternative sleep medications that are out there. And then, histamine blockers, mainly first generations, those can cause a little bit of cognitive impairment.
Yeah.
Anticonvulsants, trazodone, which can often be prescribed for sleep, that can impact the vestibular system. And so just being very cognizant of the medications you utilize, and then also the medications that are appropriate to avoid.
Yeah. And I think it's important as providers, if you're dealing with an athlete, making sure you ask that question. Have you had any concussions recently? I mean, I think it's an important question to ask, and it's important if you're an athlete and listening. It's something to bring to your provider. I may have had a concussion 6 weeks ago. I'm now having sleep issues. They may not ask that question, and you may get a med that is masking symptoms. So something definitely to be brought up either way, as a provider dealing with athletes or an athlete going to see a provider. I think the last class that we probably should touch on, just because concussions obviously cause headaches. So
yep.
What do we do for the good old, I still have a headache a couple weeks later?
So we can, there's a class of medication called triptans.
Okay.
And so we can use one of those class of medications. Again, these medications are meant to be used as needed. They're not maintenance. They're essentially considered a rescue. So I think focusing on medications that are in that tryptophan family, and there's a few other new migraine meds that have come to market, but I haven't read enough research on them to kind of speak to its effectiveness when it comes to concussions. But to play it safe, I think the triptan family.
You're thinking about Thanksgiving turkey already.
Yeah. the triptan family is the best way to kind of play it safe.
Yeah. And those are pretty, I think, well tolerated by most people. Don't see a ton of side effects. So I think it is one of those, if you are obviously still having headaches, you do need to see a specialist, neurologist, sports med, but that is definitely something you do need to investigate further. So put that out there. So I think this is one that I was like super excited when you sent this email to me about a new drug that has shown promise in its clinical trials for helping with concussions. Like, how exciting. So I read the slides and I was like, what in the world? What is a neurosteroid, right? Isn't that explain? Because this was, I was like, this is so interesting. I need to know more.
And so I know you mentioned earlier when we were talking about the category of the menstrual cycle and, the swings of hormones. And one of the things that I found interesting is when you talked about how progesterone serves as essentially a molecule to help kind of calm down that neuroinflammation that you get.
Yep.
Believe it or not, this new drug actually targets a subtype of progesterone in the brain. Actually, it's called P4. So everything is starting to kind of make sense, right? So it does have neuroprotective effects compared to, the other agents that have been used out there. I think mannitol was once used, which is a diuretic that can help essentially with some of the concussion symptoms. But generally speaking, with this new drug, it's called ONP-002. It's an intranasal brain drug delivery device. So
Which I
pretty
think,
much you have, you have what do you call it?
I
You
don't
have the
know. It's like,
mouthpiece.
yeah,
You
you have
have
a
the
mount, like this
mouthpiece.
whole mechanism, on
Yeah,
top of being a cool new drug that works on like a progesterone receptor, the actual mechanism of administration is also really intriguing because of the way you inhale it.
you pretty much blow the molecule. You have a mouthpiece for the soft palate, and you blow the molecule through your nose. And so you have
Yeah,
a piece of the device that's connected to your mouth, and the other piece that's connected, obviously, to your nostrils. And you pretty much blow the molecule right into there. And what that does is that essentially bypasses what's called a first pass metabolism, and so you don't get a lot of those systemic effects that you'll see, you know, through your stomach or through your lungs or esophagus. It goes straight into the blood-brain barrier and it's delivered to where those brain regions essentially are affected. So
yeah,
I believe it just finished phase 2, and
yeah, that's what
so
I read.
it's something worth following over the next few years. When it comes to new drug development, it can take a decade or even more for it to kind of come to market, but at least it passed phase 2, and
Yeah.
so it's showing a little bit of promise. So we
And
hope that it gets passed.
I think it's super cool how it kind of pulls everything full circle. Like we've talked about what happens during a concussion, and we've talked about the treatments and how the treatments actually affect that. So being able to pull that back to the female menstrual cycle and progesterone and
Yep.
anti-inflammatory is like, it's like this is why I like pharmacy.
Yeah. Right.
This is why I went
Hey,
into
I love trying
pharmacy.
to understand the biochemistry, even though sometimes it could be a little bit high level. But
Yeah. And I
um,
think the one thing that we I in research of talking about concussions that came up, which I find interesting, and I think this is probably more intrigued to like probably the NFL that you might see this, is using like the hypothermic chamber therapy, where you drop the blood temperature or the temperature of your brain.
yeah,
Yeah. So they had approved a new product. I saw that in last year, that they were to help decrease the amount of basically decreases the inflammation occurring in your brain really quickly by decreasing the temperature. So it's like a cooling hat.
so it looks like it shows here clinically effective in cardiology, including cardiac arrest and heart attack.
Yep. So I just thought I think it's called Pro 2 Cool. I was like, oh, what an interesting name. But it's just interesting, again, full circle. It inflammation, trying to help give the brain the best chance to have the least amount of damage.
Yeah, absolutely.
So yeah.
So that wraps up our discussion on concussions. I know that this was information rich, hopefully action packed. And again, our overarching goal is to really bring awareness. We're not trying to do any fear mongering. Is because Jess is an athlete, I'm an athlete. And so, if anything, we want to keep being big supporters of the profession.
Yeah.
Now, it's always important, anything that we talk about in this show, you always consult with your medical provider before going out there and taking these recommendations. While we are essentially healthcare practitioners, there are medical providers out there to help kind of validate anything that we are talking about. Any of the studies that we mentioned also in the show will be linked in the show notes below.
I appreciate everyone for listening. I hope if you have questions, we'd love to hear them and address them. But I hope you found this super helpful, and we look forward to having you on our next one.
All right, guys, make sure you like, subscribe, and share if you want to continue to stay educated on the content that we put out on a weekly basis. All right, Jess, good talking. Until
Thanks,
next show.
That was awesome.